This training will serve as a comprehensive guide to diabetes management. We will cover the key aspects of diabetes, best practices for clear and objective communication, and strategies for ensuring compliance with Orion's policies. By the end of this session, you will be equipped with the knowledge and skills to effectively manage diabetes, promoting safety, accountability, and communication within your team. Let's get started. What is diabetes? Diabetes is a chronic condition where the body struggles to regulate blood sugar levels due to issues with insulin production or the body's ability to use insulin effectively. In type 1 diabetes, the body doesn't produce enough insulin because the immune system attacks the insulin-producing cells in the pancreas, while in type 2 diabetes, the body becomes resistant to the insulin it does produce, leading to high blood sugar levels due to being overweight or obese, lack of physical activity, genetics, age, race, smoking. Here are some key do's and don'ts for managing diabetes. Do's. Monitor blood sugar regularly. Ensure that the diabetic resident has their blood glucose levels checked regularly, as advised by their healthcare provider. Provide proper nutrition. Follow any dietary restrictions provided by the resident's healthcare provider. Encourage physical activity. Support appropriate physical activity, as exercise can help manage blood sugar levels. Ensure activities are safe and suitable for the resident. Educate on symptoms of hypoglycemia. Familiarize yourself with the signs of low hypoglycemia or high hyperglycemia blood sugar, which we will go over in the following slides. Promote medication adherence. Ensure that the resident takes their prescribed medications, insulin or oral medications, at the correct times. Monitor emotional well-being. Recognize that emotional stress can affect blood sugar levels, so support mental health management as part of the overall care plan. Have emergency protocols. Familiarize yourself on Orion's emergency procedures if blood sugar levels become dangerously low or high, which we will review in the following slides. Don'ts. Don't ignore signs of blood sugar imbalance. Never dismiss symptoms of hypoglycemia, for example, dizziness or shaking, or hyperglycemia, for example, excessive thirst or frequent urination. Prompt intervention is crucial. Don't allow skipping meals. Skipping meals can cause blood sugar levels to fluctuate. Encourage consistent meal times and snacks as needed. Don't restrict fluid intake. Dehydration can worsen blood sugar control. Ensure the resident has access to water and stays properly hydrated. Don't encourage excessive sugar consumption. Avoid offering sugary foods or drinks that could cause blood sugar spikes. Stick to recommended snacks and meals that align with diabetes management. Don't neglect mental health considerations. Stress, anxiety, or depression can affect diabetes management. Ensure the resident has the necessary support to manage behavioral health concerns as well as their diabetes. Don't ignore medication side effects. Be aware of any side effects of diabetes medications and address them promptly with medical staff. Don't delay seeking medical help. If blood sugar levels are consistently out of range or if there are concerns about the resident's condition, seek medical advice without delay. According to Orion Homes' policy, if a resident's blood sugar reading is 400 or above, they must be taken to the emergency room immediately. If the reading is 70 or below, if a resident's blood sugar is low, provide a source of carbohydrates or sugar, such as orange juice, peppermint candy, peanut butter and crackers, or cheese and crackers, after 15 minutes and recheck their blood sugar levels. If the resident is unconscious, experiencing seizures, has slurred speech, or if their blood sugar is below 45, call 911 immediately. These readings can indicate a serious medical issue that requires prompt attention to ensure the resident's safety and well-being. Always monitor blood sugar levels closely and act quickly in these situations in accordance with this policy. When caring for residents with diabetes, it's important to be aware of the following signs and symptoms like hypoglycemia, low blood sugar. Some signs to watch for shaking or trembling, sweating, dizziness or lightheadedness, irritability or mood swings, confusion or difficulty concentrating, hunger, weakness or fatigue, rapid heartbeat, blurry vision. If a resident displays any of these symptoms, offer a quick source of sugar, for example, glucose tablet, juice, or candy, and recheck blood sugar after 15 minutes. Hyperglycemia, high blood sugar. Other signs to watch for are excessive thirst or dry mouth, frequent urination, fatigue or weakness, blurry vision, nausea or vomiting, headaches, slow healing of cuts or infections. If a resident displays any of these symptoms, encourage fluid intake and contact a healthcare provider to adjust insulin or medications as necessary. Diabetic ketoacidosis, or DKA. Additional signs to monitor are nausea or vomiting, abdominal pain, rapid breathing or shortness of breath, fruity smelling breath or nail polish removal, smelling breath, confusion or drowsiness. If a resident displays any of these symptoms, seek immediate medical attention as DKA can be life-threatening. Foot problems. Other symptoms to watch for: cuts, blisters, or sores that don't heal, redness, swelling, or warmth on the feet, numbness or tingling in the feet or legs, foot infections or ulcers. If a resident displays any of these symptoms, encourage regular foot inspections and good foot hygiene. Seek medical care if any of these signs are present. Infection or wound healing issues. Other symptoms to watch for are unexplained wounds that take longer to heal, redness, warmth, or pus at the site of a wound, frequent infections, for example, urinary tract or skin infections. If a resident displays any of these symptoms, monitor for signs of infection and encourage proper wound care. Contact a healthcare provider if an infection develops. Changes in mental status. Other indicators to monitor are confusion or difficulty concentrating, sudden mood changes or irritability, unexplained dizziness or fainting. If a resident displays any of these symptoms, monitor for signs of hypoglycemia or hyperglycemia and address accordingly. Dehydration. Additional signs to monitor are dry mouth or skin, decreased urine output, sunken eyes, dizziness, or lightheadedness. If a resident displays any of these symptoms, ensure adequate fluid intake, especially if blood sugar levels are high. By staying vigilant for these symptoms and responding appropriately, you can help manage and prevent complications for our residents with diabetes. Insulin is commonly administered in areas with sufficient subcutaneous fat to ensure proper absorption, such as the abdomen, avoiding a 2-inch radius around the belly button, the upper arms, thighs, or the buttocks. The abdomen is the most frequently used site because it allows for faster and more consistent absorption of insulin into the bloodstream. Rotating injection sites is important to prevent tissue buildup or lipohypertrophy, lump formation, that can affect insulin absorption and effectiveness. For guidance on administering insulin and checking blood sugar, you can refer to the 2 videos available on our YouTube channel. If you have any questions, never hesitate to ask. We are a team and are all here to help each other. Contact your manager if you have any questions or concerns.